The extrinsic muscles of the upper limb can be subdivided into three different groups based on their orientation or sites of muscular attachment. The first of these are the anterior axio-appendicular muscles, and as their name would imply, they are going to be attached more anteriorly on the thoracic wall, and they will begin at the axial skeleton but insert on the appendicular skeleton. Their counterparts are the posterior axio-appendicular muscles. Now the third group is going to be the scapulohumeral muscles, which as their name implies would begin on the scapula and end on the humerus. Let's now take a closer look at these three groups of muscles individually. The first group, the anterior axio-appendicular muscles, is a group of four different muscles. The largest and most superficial and prominent of these is the pectoralis major. Now the pectoralis major is a large dynamic mover of the upper limb that begins on the sternum and the clavicle as well as the costal cartilages, and it's going to insert on the humerus. If we hide the pectoralis major, we can see the other three muscles more clearly, including the pectoralis minor, which is going to be positioned deep to pectoralis major and attach from our second, third, and fourth, or in some cases the fifth ribs, up to the coracoid process of the scapula. Inferior to the clavicle, we see the small subclavius muscle. This small muscle is going to assist in pulling down our shoulder by pulling down on the clavicle. Now the fourth of these muscles is the serratus anterior. This large muscle is going to attach in a serrated or jagged appearance to our ribs after originating from the medial aspect of our scapula. So the serratus anterior is going to be in this anterior axio-appendicular group due to its anterior attachments along the ribs. The next group of muscles are the posterior axio-appendicular muscles. And here we're going to see two large muscles more superficially oriented and three muscles more deeply located. The first of these is a large diamond-shaped muscle in our back that is positioned more superiorly. And this muscle is the diamond-shaped trapezius or square-shaped trapezoidal-shaped muscle. Inferior or deep to this muscle, we see the large, broad, flat muscle of the latissimus dorsi. So these first two muscles are more superficially located, and they're going to take up a lot of room and create large dynamic movements similar to what we saw with pectoralis major anteriorly. Now, deep to the trapezius, if we were to hide this muscle, which we have done on the left side of this specimen, we can see the three underlying deep muscles, beginning superiorly with the levator scapulae, the intermediate muscle, the rhomboid minor, and the most inferiorly, the rhomboid major. Now, the rhomboid major is going to be positioned most inferior, and it's going to be a rhombus in shape, as is the rhomboid minor. The rhomboid minor we can identify due to its close proximity to the spine of the scapula, while the rhomboid major is positioned inferior to it along the medial border of the scapula, and lastly, the levator scapulae positioned superior to that spine of the scapula. The last of the three groups we're going to take a closer look at in more detail, and this is going to be the scapulohumeral muscles. Now, the scapulohumeral muscles are going to be attaching, as their name implies, from the scapula and attaching on the humerus. These are going to include the large deltoid muscle, which is triangular in shape on our lateral aspect of our shoulder, the teres major muscle, which will be positioned inferior to the teres minor muscle. Now, the other four muscles in this group are going to form part of a group of muscles known as the rotator cuff, and we'll take a closer look at them in more detail in a moment.